I'm incredibly pleased and honored to introduce to you the person who will be our next president. So I want to tell you a little bit about Dr. Christie. Many of us know her because of her enthusiasm, her energy, and let me tell you, she could be there late at night with all these young people here with that same energy and enthusiasm. But Dr. Christie is a consultant psychologist and professor of pediatrics and adolescent psychology. She currently is the clinical lead for the Department of Child and Adolescent Psychological Services and has an international reputation for its application on systemic psychological practices in the care of young people with chronic disease. And why that's important is it's not just about adolescents. And one of the things we want to continue to own as SAHM is that population of people that we would call young adults. Dr. Christie was awarded her PhD in neurobiology from the University College of London and also was a Fulbright Scholar before joining the University of Oxford Department of Experimental Psychology as a Medical Research Council Research Fellow. She joined the Great Ormond Street Hospital as a Leukemia Research Fellow prior to joining the Department of Psychological Medicine as a clinical psychologist. 20 years ago, Dr. Christie joined the University College of London Hospital in order to set up an adolescent unit with her colleagues. So it was really instrumental in giving us this idea of bringing medical science together with psychological well-being. So I want to make sure that we acknowledge that because we understand that as being important in recovery, in treatment, and in diagnosis. She was awarded the Diabetes Award in Adolescent Health and the Society for Adolescent Medicine for Best Practice Award for Managing Diabetes in 2001, and the Award for Outstanding Scientific Achievement in Clinical Health Psychology in 2004. She also was an Adele Hoffman 2013 awardee. Hopefully also many of you have had the opportunity at our first authors table to actually see one of the books that she authored, integrating really diabetes care and management with psychological well-being as well. Dr. Christie is an international trainer in speaking and motivational interviewing and solution-focused therapies and has published over 80 peer-reviewed publications. And while it's often really important to give someone scholarly attributes, I think that I would be remiss if I also didn't include the things that were personal. And so I've had the opportunity to work with Dr. Christie in the past year, and I have appreciated her energy, I've appreciated her perspectives, I've appreciated her intellect, and I'm incredibly grateful and look forward to what she'll bring to our society as president. So I would now like to introduce to you a person that I'm also happy to call a friend, Dr. Christie.
Hang on a minute, I've just got to do a tweet. Hang on. Hang on. Okay, no, yeah. Okay, Manuel. Yeah, hang on, wait a minute. Okay, all right, great. Okay, good, yeah, all right, ready? Okay, we go. All right, okay. I've already tweeted it. If you follow me on Twitter, you can retweet it. And if you did, there would be 800 extra voices added in the next 20 minutes. Social media is pretty powerful. And in its many, many forms, it creates and provides a voice for young people to actively engage one another in social change. It also allows them to circumvent controlled media communication channels. How many here have been unfriended by their children on Facebook? It's okay, he's a grown-up now, he friended me back. Partly because he wanted money. The other thing about social media is it is no longer possible to just say something and for it to get hidden or suppressed or ignored. The pronouncements by people in authority are retweeted and commented upon in many, many ways. Sometimes in an amusing way, sometimes in a very angry way. Now, this particular comment on the well wishes of a certain individual was a sort of funny one. If you want to see the really angry comments, then check out God's Facebook page. I know, Tamara, who knew God has a Facebook page? Mobile phones, the internet, instant messaging, social networking sites, young people have access to these all over the world, all of the countries and nearly all of the young people. And I wonder how many of you, apart from Michael Rich, are able to identify all of these logos up here. Social media creates opportunities. It creates opportunities for young people to become active catalysts for change. And we shouldn't doubt the power of social media because of the attempts to censor or restrict access in countries where there is significant social unrest, or indeed as a way to potentially influence the outcomes of important democratic processes, such as elections. Now, where has that happened recently? Social media can be a medium for positive health promotion using population-focused social marketing, and we heard about that the other day in one of the plenaries. Rua told us about a wonderful example of this. And there are very many examples of increase in access to mental health support through e-therapy and guided self-help for depression and anxiety, just for an example. And how many of you right now have got a mindfulness app on your phone? The rest of you should get one. There is the potential for damage, however. Even with this no longer new technology, it should not become underestimated. We are becoming a swipe left generation. Sadly, for every positive website or YouTube video, there are potentially negative and damaging ones. Pro-Anna movement websites, radicalizing vlogs, Instagram self-harm pictures, and the amazing attempts that, despite Instagram's best attempts to stop young people searching for these, young people find new ways to tag these pictures so that they can still be found. And easily accessible pornography. These powerful, emotive, and graphic images publicize dangerous and damaging behaviors, which go viral in minutes. This results in changes in societal norms or expectations about what is and isn't okay to happen faster than ever before. And we know that excessive screen time and internet addiction can create sleep problems. This is the only graph I'm going to show you. It can result in cyberbullying, which we heard about yesterday, low self-esteem, and mental health issues, including school refusal. Just got to check my Facebook. Hang on a minute. Adolescent health is no longer the minor speciality it was when the very first program in adolescent medicine opened up at Boston Children's Hospital, a small hospital on the east coast of America, in 1951. And some of you, those of you that, you young people, may not even know that this is Dr. Gallagher. This is James Roswell Gallagher, after whom our Gallagher lectures are named. Half the world is under the age of 25. And we've already heard that currently we have the largest cohort of 10 to 24-year-olds. Now, the last time this was counted, it was 1.8 billion. I really feel sorry for that person that had to go around and count everybody. 1.8, 1.9, oh, damn, I've lost count. We need to take good care of these kids because they're the future parents of our grandchildren, our great-grandchildren, and maybe even for some of us, our great-great-grandchildren. And they have the potential to transform the world. They have energy, which we heard about last night. They're innovative, which we've heard about over the last 3 days. They're productive and they create progress. And more importantly, they hold on to hope when many of us let go. So here's the good news. Economic, technology, social, demographic structures, and the work by you and others who are like you are making changes. Reductions in infectious diseases, significant changes in infant and maternal mortality, cancer survival rates, all improving. And in the first decade of the 21st century in the United States, child deaths decreased by over 30%. But, and here's the worm in the apple, suffocation in children went up by 54%, and poisoning in adolescents doubled. This is the law of unintended consequences. As we vanquish the killers of the 20th century, a new dragon emerges, non-communicable diseases, and these are the things that we need to think about and remember. This is why we all get up, without a hangover, with a hangover, to go to work, and why we're all here today, to support each other, to learn and share and advocate for global adolescent health equity, to give every young person around the globe what they need to be successful. And what do they need? Well, we know what they need. They need national wealth and income equality. But in countries which purport to have that, it needs to be equal across all races. They need safe and supportive families, which for many is unattainable through poverty or conflict. There's a future leader over there. They can stay, I don't mind. A little bit of crying's okay. They need safe and supportive schools. And isn't it ironic how difficult it is to fulfill that promise in one of the richest countries in the world? Young people must have education for all, regardless of race, gender, sexuality, or income. And I think the last 3 presidential addresses have all demanded that. And this next one is a real duh. We must demand universal health care. We must demand it, though, where there is parity of esteem for mental health as much as there is for physical health. And you know what, guys? We are saving up trouble for ourselves in the future. 70% of premature adult deaths reflect behaviors that begin in adolescence. Increases in mental health disorders, in suicide, homicide, obesity, malnutrition, gun violence, road traffic accidents, precancerous cervical lesions worldwide. We've heard again and again and again, they are going up. And unmet mental health need creates nearly half the burden of disease in young people aged between 10 to 24. More teenagers and young people and adults die from suicide than from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, influenza, chronic lung disease combined. In the last hour, 145 young people in the United States of America have made a suicide attempt. And by the end of the day today, when we're all celebrating at the international dinner, and this is a serious point, Pierre. By the end of the day, over 3,500 people in grades 9 to 12 will have made a suicide attempt. The really scary thing is that 4 out of 5 will have indicated their intention, but nothing will have been done. Prevention works. Alcohol, tobacco, and substance misuse, mental health problems, unsafe sex, risky, unsafe driving, and violence, including gun violence, they are all largely preventable. And developmentally appropriate prevention policies and programs have shown short and long-term reductions in all of these behaviours. And I thought I'd show you an example, 2 examples, one from Australia and one from America, in an attempt to This is a multi-country randomized control trial. The results aren't in yet, but I'll be very happy to present them at next year's research platform. This is our vision. And each and every one of you that's here today is already a leader, contributing to the delivery of health, well-being and equity for all young people around the globe. And our mission statement clearly sets out the steps by which we will achieve this vision. And the wonderful program put together by Manuel and his hard-working program committee has taken the first steps to achieving this by ensuring that the program in #SAHM18, for those of you that are tweeting, addresses clinical practice, care delivery, research, advocacy, and professional development. I'd like you to join me thanking the program committee. Manuel. You asked, and you got, over half of the sessions directly focused on clinical practice throughout the 4 days of the conference. And you asked, and you've got, maintenance of certification credit hours. You asked, and you've got, 25% of the conference devoted to research, creating a global research agenda to advance adolescent and young adult health, and ensure that all SAHM programs, products, and activities are based on the best evidence and practice across North America and international levels. SAHM will be the trusted source for knowledge in research on adolescent and young adult health, and focusing increasingly on translational research, we will connect academic, clinical expertise and practice. For the next 3 years, each and every one of you please join me and the SAHM leadership to focus on 3 pillars of our strategic plan. Beginning with advocacy. The last 12 months, as many of you will understand, has been a particularly busy time. And the Advocacy Committee has worked tirelessly, focusing and identifying important political decisions that have the potential to undermine the health and well-being of young people and their families, discriminating against groups on the basis of nationality, religion, gender, race, and income. But using the strengths and the skills of you, the members of SAHM, and engaging in leveraging partnerships and linkages with key academic and clinical organizations around the world and in the USA, we have been able to contribute to the voice on behalf of those that cannot speak for themselves. And I'd like to acknowledge the Advocacy Committee. And Krishna, where are you? Over there. We will develop an explicit advocacy agenda that will promote adolescent and young adult health nationally and internationally. This will increase the visibility of SAHM's advocacy efforts for both internal and external stakeholders. With your help, and this is the key, with your help going forward, we'll improve mechanisms for you all to contribute to SAHM becoming a leading resource for advocacy in adolescent and young adult care and health professionals who care for them. The second pillar is education. SAHM meetings demand high-quality education, and this was a priority of the membership survey last year. So we have focused on improving the quality of the educational and professional development activities that have been offered in SAHM's annual meeting. We are committed to maximising the effectiveness and usefulness of the adolescent medicine resident curriculum, and also creating webinars which are designed by experts, you guys, and created for adolescent health providers, training program faculty, professional school faculties, and students interested in adolescent healthcare. If you don't know about these, go on the website. Not now, don't go on the website now, but go on the website and look at them. We intend to explore and identify innovative educational and professional development activities all year round. These innovations will build the profile and perception of SAHM and its annual meeting as the major international educational resource for adolescent and young adult health. And again, with your help, SAHM will be becoming a leading resource for innovative education and professional development for all adolescent health professionals. Now, position papers are an important component of this, and we need you to volunteer. We need you to be part of the committees that have oversight and track position papers alongside Paula Braverman, who is the Director of Publications, who does an amazing job reading every single publication, helping edit it. Is Paula here? Is Paula? Can't see her. Anyway. With your help, we're going to evaluate our existing processes and procedures connected with our position papers and review current timeframes. And I know from talking to many of you that this is really important to you. So we're going to try and think about how we can introduce fast track and improve the whole peer review process. Now, I thought I'd start this. I haven't actually submitted it through the intent process, but I thought I was going to get in touch with the CDC and see if they would co-author this particular paper with me. This is a proposed statement on acceptable words, and you can see that our positions are that we will work with vulnerable young people, we will encourage entitlement to education, we will promote diversity and support transgendered youth, we will value the right of the fetus, and we will be evidence-based and science-based. I want to talk now to the third pillar, which is governance. And none of what has gone on over the last 50 years, and particularly the last year, is possible without an amazing and dedicated leadership team. And I have been deeply honoured to work alongside past President Greg Zimmett, Tanya Mullins, where are you, Tanya? And the passionate and eloquent and prolific President Tamara Coyne-Beasley. As I step into the office of President this year, I've been inspired by Tamara's commitment to you, all of you, and to SAHM, but most of all to the young people that she serves and works for uncaringly. Please, guys, would you just all three of you stand up and let us say thank you. Now, I wonder how many of you have a real sense of what happens behind the public face of SAHM, the website. This 50th anniversary conference, which has the highest attendance ever. The emails, the listserv, the press releases, the phone calls, and wait for it, the requests for password resets. You guys really need to write those passwords down somewhere, because we get a lot of requests for resets. Everything else that happens without any apparent effort is down to the incredibly hard-working team at Kellen, led by the redoubtable, the unruffable, the unflappable, and the ever-charming Mr. Ryan Norton. Now, sadly, for personal reasons, Gabrielle wasn't able to be here together, and some of you may have noticed an old and familiar face. Caitlin, I'm just warning you, if you put pictures like this on Facebook, they're going to end up in public presentations. Where is she? Where are you, Caitlin? Woo. I did find a really nice one, but I thought this was funnier. SAHM will grow and prosper, but it needs resources and it needs infrastructure. And here again, I'm going to tell you it's your help that we need over the next 3 years to improve these current governance processes and communication structures. We promise to you that we will ensure an emphasis on effectiveness, on efficiency and transparency. We will work alongside the standing committees, the special interest groups and regional chapters to improve their ability to further our mission statement. And I know it's flashing red, I'm just going to ignore it. I haven't got very many slides left, it's okay. I know, yeah, but I'm the president. Let us not forget, nothing about us without us. No policy or practice should be decided without the participation of those people who are affected by that policy. Now, I discovered that this is a really old phrase. And it's particularly familiar to those of you, perhaps in the former colonies. If we believe in this principle, that young people's participation and experience should be at the heart of everything that SAHM does, then there is an imperative to join with young people and listen to them, to learn from them, to advocate alongside them, and create programs and educational materials that are co-productions with them. We must acknowledge, however, the challenges. Implementing these recommendations demand resources, money, staff, and infrastructure. But those are all pretty trivial, let's face it, and things like that have never stopped SAHM before. A wonderful innovation in this year's conference has been the Youth Involvement Working Group, and we plan to expand it further for 2019. So with your help, your time, and your money, Let's start a star. Let's start collecting now. Now is the time to move forward. Now is the time to increase and institutionalize youth involvement as part of SAHM's culture. At last night's dinner, or gala, as Jenny Primus and I like to call it, we honoured the past and celebrated the present and thought about how to invigorate the future. SAHM has grown and prospered since 1968 as a result of its diverse, multidisciplinary global membership. We, who are part of this present moment, must focus on it, but also focus on leadership and capacity building the future adolescent and young adult healthcare professionals. So next week, when you go home, and you clearly articulate the value of being part of this family and mentor the future leaders of adolescent health medicine, please encourage them to join our family. Just think, if every single person in this room was to recruit 1 or 2 new members over the next 2 years, we could hit 2020 in 2020. You can make this happen. And I was thinking about 2020 and what else is going to happen there. And I thought, if we really worked hard, we could make this happen. Oh, let's not go there. I want to finish with my own past, present, and future. Once upon a time, there was a little girl. I've practiced this so many times. Once upon a time, there was a little girl whose dad told her every day that she could be anything that she wanted to be, as long as she worked hard, and whose mum comforted every failure, and there have been many failures over the years, but she reminded me that what was for me would not go by me. And my mum and dad would be so very proud to know that I have been honoured by you choosing me to be your president. And here's my present and future. My sister, she's wearing the silly hat, she's going to kill me, and her family, and my husband and partner and best friend for over 40 years, who's flown to be with me today. Andrew, please stand. You're the first man now, aren't you? Yeah. And the future, well, my wonderful sons, Alexander and Sebastian, my 2 lovely daughter-in-laws, and my 4 beautiful, clever, funny grandchildren. The one at the front showing off, I don't know who she gets that from, actually. And Casey, my big girl, who has just stepped into adolescence with a great deal of trepidation. And we were photobombed by the bear, we don't know him. So as your president... Oh! Sorry, wrong picture. Yeah, this is more like it. As your president, I promise you passion and enthusiasm, and I give you a promise that over the next 12 months we will continue to build participation and ongoing engagement with you, the members of SAHM. Your society has already transcended its original North American boundaries by appointing international presidents and ensuring diversity of race, gender, discipline, and hair colour. I think I'm the first. Am I the first redhead? I think I'm the first redhead. I believe that SAHM's strength comes from its core US clinical and academic membership interacting with the rest of the world. We will benefit by learning from each other what works well in different cultures and climates, understanding our own strengths and weaknesses of each other's healthcare systems, and reaching out to create cross-cultural professional training opportunities, learning from the best in every part of our global community. I have a dream. One day we will take our place on the world stage as the International Society of Adolescent Health and Medicine. Now, if you'd excuse me, I've just got to do a quick tweet.
Congratulations! Hello, Mum. Congratulations on becoming president. I'm sure you're going to do an amazing job. Sorry we can't be there, but lots of love from Wales and cheers! Cheers.